Project Management and Implementation of EHR, presented by Project Managers of Healthy Community Hospital. The goal of our organization, Healthy Community Hospital, is to implement EHR within our hospital in order to improve the quality of healthcare provided and to reduce medical errors. The mission of this project is to develop a projected timeline to illustrate how long it will take to implement an EHR in each department of our hospital. Additionally, the timeline reflects the possible changes that arise during the implementation process. EHR is not something that can be implemented all at once. Therefore, implementation was separated by department. These departments were considered to be high-level tasks: patient information management, laboratory, radiology, nutrition and food services, pharmacy, imaging, clinical information systems. Laboratory, radiology, and nutrition were dependent on the completion of patient information management. Pharmacy was dependent on the completion of laboratory. Imaging was dependent on the completion of radiology. Clinical information system was dependent on the completion of all other high-level tasks. All high-level tasks have subtasks, some of which are dependent on the completion of other tasks. An example is shown in the patient information management task, for which the subtasks were patient registration, admission, discharge, and transfer. Patient registration was dependent on the configuration of Enterprise Master Patient Index. Admission, discharge, and transfer was dependent on the completion of patient registration. For each subtask in all high-level tasks, configuration must be completed before training. Our software allowed us to make changes in the project if certain tasks were completed ahead of time. For such cases, times were automatically adjusted for other project tasks that were dependent on the changed task, as well as for the entire project time frame. For example, for the clinical information system task, the configuration of order management lasted 15 days instead of 30 days. This changed the total days for order management from 35 to 20 days, the total days for clinical information system from 152 to 137 days, and the total days for the entire project from 324 to 309 days. Overall, our software was useful in creating a timeline for implementing EHR and adjusting for unexpected changes. However, the process was extremely tedious, and if you missed something or miscalculated something, it could alter the entire project. Microsoft Project can also help a project manager put the entire project into perspective before the start time, which is extremely useful. It is also a useful tool for making strategic and organizational changes that can significantly reduce the completion time. It may also help an organization choose an EHR vendor based on the projected time frame that each vendor offers.